contained?
Well, as we all know, until recently it was a disease that was confined in the West, few countries in West Africa. But with the transportation, the airlines, people are flying in and out. We're always worried about importing the disease in this country. And since the Dallas outbreak, we know that it is not only it has become more of a reality than just a fear. Well, on the other hand, Ebola is not something that is transmitted via air, so it's not something that you have to be worried about just because you are in the same room with another person with Ebola or in the same airplane. It requires that the person's secretions or blood has to contaminate your wound or mucous membrane, such as mouth, nose, or eye, things like that, before you can catch Ebola. So we have to be careful. We have to be prepared, but I don't think it's a big concern at this point.
How do you imagine the nurses were affected since they were wearing protective gear?
Well, the protective gear can do only so much. After you take off your protective gear, it's important to wash your hands and use antiseptic, hand wash and things like that. And also, when people are taking off the contaminated protective wear, sometimes they have a tendency to touch up the outside of the gown or outside of the gloves by mistake. I've heard that people, just touching eyes while wearing gloves, or when they take out the gloves, they might have contaminated their finger and touched their eyes. So that could be a potential way. So I don't know exactly how it was transmitted, but I heard that it is while taking off the gowns and gloves. And we have an similar example from the SARS outbreak in Canada. Healthcare people who were infected were not doing not using the proper technique when they're taking off their gowns and gloves. So that might be the reason.
What do you think of the proposal that a lot of people were saying we ought to have a restriction and have no more flights coming in from those regions? What is your thoughts on that?
Well, that's a very good question. I mean, in ideal world, probably it shouldn't happen, but in the real world, I guess people have to go even to help them. A lot of people are traveling there, committing to help the people who need help.
Let's just take one at a time. As far as the people coming into the United States, I mean, there's the argument that we could either with military flights or with charter flights bring healthcare people to the affected areas.
Okay.
I'm not trying to put words in your mouth, but if I'm hearing you, are you saying that we should stop the flights out of the affected areas into the United States, or what?
Well, I mean, it's a good idea, but I don't know if it's realistic, just because how long you are going to do that, and we don't know how long that epidemic is going to last in those countries. So I think it's something to think about, doing a better job with screening rather than stop everybody flying in. So, I mean, that's my opinion, but people can differ.
Okay. Now, what would you say to the people in general about how should we be reacting to this? Well, let me actually, before we do that, relative to the CDC and how they've been handling this, what are your thoughts on them? Do you think that they have a handle on it? They've been under a lot of criticism. Is that criticism legitimate, or do you think they've been doing an excellent job?
Well, it's a learning curve for everyone because it's a new disease. I guess it was there since 1970s. We knew about the disease, but only few people were doing research in the area where know the disease very well. It was otherwise almost forgotten, by the rest of the, let's say, medical communities, because we thought it was just going to be contained in West Africa like in 70s. So now, since it has come out of Africa and it has caused a bigger epidemic in Africa itself, people are taking more interest. I believe that CDC has sent out a lot of information to us. We get at least 2 or 3 information packets every week. But is that adequate? I don't think so, because either they're also learning or they don't understand what is the need of the the frontline people like us, the community physicians and the people who are working on the ground. So yes, deliberately, definitely, I'm not saying that we are not getting any information. We're getting a lot of information. My email gets flooded with information. But at the same time, is that adequate? No, because as we heard today, we still have a lot of questions that probably training, more sessions, online sessions and training, things like that
Some
can
of the
clarify
nurses said
questions.
the information was too vague, that the
Correct.
protocols didn't really spell out
Correct.
all that they actually needed. What
Yeah.
kind of protective suit should we be buying?
Correct.
And let's just say this before we let you go. Our hospitals, from your experience, what would be the impact if just we had even a few Ebola cases? How quickly could those cases overwhelm our healthcare infrastructure, which is not set up to quarantine people or to have 20 healthcare professionals treating one patient 24/7?
So the hospital, I've been meeting with the medical directors of the hospital and trying to coordinate what if a patient shows up in one of our clinics, how to coordinate that. So they are coming up with a plan to contain those patients. Do we have foolproof system? Do we, can we contain it altogether? Are we prepared very well? Probably not quite adequately, but we will try best to contain it, within one particular setting and not try to minimize the number of people who get exposed. But from treatment point of view and other kind of help, we definitely need more help from CDC or from the centers that have expertise in taking care of Ebola patients. Does that answer the question?
Well, that answers part of it. I think I just wonder, in other words, for your normal staffing of nurses and facilities, whether, I don't mean just where we are standing in Springfield, Illinois, but just even at hospitals around the country, it just seems that this is so different of a type of infectious disease that it would require so much more care, given the quarantine, given the nature of the disease, that I as a layperson wonder how quickly would we overwhelm our healthcare facilities so that then if something else happens, just your normal influx of patients, you don't have the infrastructure of personnel and maybe just cost to take care of your normal workload then.
Right. So that has two parts. One, taking care of a patient who's already infected or highly suspicious to have Ebola. So a person who actually needs medical care, and that will require a lot of team effort because it requires expertise from not only infectious disease physician but also from intensive care physician, things like that. We do have large number of intensivists and the infectious disease physicians in the community to handle tens of people at the time. But if we have other people who are in contact with them and we have to do a screening at a mass level, then probably we need help. But in either case, it's a team effort. If a hospital runs out of the people, then probably they should get help from other hospitals and surrounding places. So I think it is achievable. Of course, we need to coordinate and come up with a plan, and that is the thing where CDC or IDPS can take lead on. To put a plan together, and that's the guidance. I think the other thing that was missing in CDC's guidelines so far.
All right. Well, thank you very much.
Thank you.
Appreciate it. You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.